My name is Dr. Rene Roberts. I am a board-certified family medicine physician and also a fellow of the American Academy of Family Physicians. I have been working at Oak Street Health now for about 7 months. I think the best advice that I can offer a patient if they're coming to the doctor and they're nervous about talking about specific health topics is one, to just be open and honest as best you can. Medical providers have gone through several years of training. We've actually gotten lots of practice working in these specific types of situations. So there really isn't a lot that's going to shock us or surprise us. One of the best ways that we can help you as a medical provider is if we establish open, honest communication as well as establishing trust with each other. And it's very challenging to establish trust with a patient if they're not very forthcoming about certain topics that they want to discuss. Our focus is on you as the patient. Our specialty is you, and we want you to feel comfortable speaking with us. So again, there's no need for embarrassment, there's no need for shame when it comes to talking about subjects that you might think are very personal or very sensitive to you. 9 times out of 10, we've probably have dealt with it before with a previous patient, and we get training on how to deal with these sensitive topics as well. One thing that I can't stress enough is that some of the things that you keep to yourself, some of your deepest, darkest secrets, those are the very things that actually could be impacting your health and potentially impacting your health in a negative way. And so when you build trust with us, establish trust with us, and we build that rapport with you during our doctor visits, provider visits, just let that be reassurance for you that it's okay to bring up those sensitive subjects, and that will help us be able to care for you better. Yes, I believe mental health is absolutely a fantastic topic of conversation to bring up. Mental health as well as physical health help make up you as a whole person. We can't do one without the other. And I always like to let my patients know there's no shame. There's no shame whatsoever if you want to bring up those sensitive topics, whether that's feeling lonely, feeling sad, depressed, anxious. Sometimes even patients might be seeing things or hearing things that are not there that cause them to be afraid, and they're too hesitant to bring that up with their doctor. That's actually the best time to bring it up, is during your doctor visit. I think to help patients that are concerned about the number of medications that they're taking is one, of course, bring it up. Mention it to your medical provider. One of the best things you can do at each and every visit is to bring all of your medications with you, so that way we can discuss any questions that you may have or concerns that you may have about a particular medication. Oftentimes patients may not realize that some of the medications that they're on actually can be combined with other medications to actually lessen what we call a pill burden, or the number of pills that you're taking each day. Discussing finances is an appropriate topic to bring up during your visit with your medical provider. Even though we may not be able to directly answer your question, I know that we would be more than happy to direct you to the people that can best assist you. Another thing too is healthy eating. I think that's a valid conversation to have with your healthcare provider. Not only the types of foods that you're eating, but how much you're eating. And I would even go farther to say, if you're having trouble accessing food, that's also a very important piece of information that your medical provider needs, particularly if you're suffering from chronic conditions such as diabetes, where we need to keep a close eye on your blood sugars, or heart failure, where we need to make sure you're not eating too much salt so that you're not fluid overloaded. We understand that times can be tough for patients, and stretching your dollar can be very challenging, and we understand that sometimes patients might be taking shortcuts and doing so by not buying as healthy food as they possibly can. But these are all things that you should definitely bring up during your visit so that we can see how best to help you. With regards to physical activity, that's equally important, and we also understand that some of you may have mobility issues, whether that's knee pain, back pain, hip pain, or just had an orthopedic procedure. There are ways that we can work around that. One of the things that I love at the Oak Street Health Center that I work at is that a couple times per week we will actually have line dancing classes, or a dance instructor that will come in. We'll get the music playing, and patients are free to come in, dance with us, take a line dancing class, but that's a great way to increase your physical activity and also make some really great social bonds and connections with other people in your community.